We Got Us is a Boston-based grassroots collective of Black community members, students, and health professionals dedicated to empowering our community with health education and healthcare access. Today, we're here to have real talk about the COVID vaccines. By now, it is no secret that COVID-19 has had a disproportionate impact on our community. The statistics are sobering. Black people are nearly twice as likely to die from COVID-19 compared to our white counterparts. Indigenous peoples are more than 2.4 times as likely to die from COVID. Latinx folks are nearly 2.3 times more likely to die from COVID. These harrowing disparities are largely due to systemic racism, lack of access to quality health care, and adverse living conditions precipitated by racist policies like federal redlining have led our communities to have a disproportionate number of comorbidities like asthma, diabetes, and hypertension that put us at higher risk of death from COVID. Additionally, we're among the most likely to live in crowded living conditions, work as essential workers, and have limited access to PPE and paid leave. According to the CDC, last year, the average life expectancy dropped nearly 0.8 years across the country. For Black Americans, our life expectancy dropped 2.7 years. COVID-19 is out here and has affected our community, not just in lives that are gone too soon, but also jobs lost, kids not being able to attend school, and families and communities not being able to congregate or get together. Mask wearing, social distancing, and hand washing have been and continue to be our most useful tool for beating the pandemic. Now we have another power tool in our arsenal to beat COVID-19, the COVID vaccines. Currently in the United States, there are 3 available COVID vaccines that all work a little something like this. The vaccine introduces a part of the virus to our bodies that is recognized as foreign by our immune system. Our immune system then generates antibodies, which are our body's defense against foreign materials like viruses. These antibodies give us immunity to COVID-19, so if we were to encounter the virus, we would be protected. The Moderna, Pfizer, and Johnson & Johnson vaccines have all been shown to be very effective and prevent people from developing COVID symptoms and eventually needing to be hospitalized. All 3 vaccines have been studied in rigorous clinical trials where the efficacy and safety of the vaccines have been closely studied. Importantly, these clinical trials had Black and Brown participants that reflected the representation of these groups in the general public. The trials also included folks with pre-existing health conditions like diabetes, heart disease, and obesity. And to date, the CDC reports these vaccines are also safe for those who are nursing. Thus far, tens of millions of Americans have already received vaccines, and they have been shown both in trials and in real life to be very safe. When people do get the vaccine, some report feeling side effects like arm soreness, fatigue, fevers, chills, swollen lymph nodes, and body aches. It's important to remember that these side effects are self-limiting. They go away after a day or two and indicate that our body's working to protect us. It's also important to know that as more people get the vaccine, the more we will continue to learn about rare, 1 in a million side effects. This was the case when the FDA decided to pause the administration of the Johnson & Johnson vaccine to assess for the risk of blood clots that had occurred in women between the ages of 18 and 50. After learning more about these side effects and how health professionals could better recognize them to help protect us, the FDA reapproved the use of the vaccine. Hearing about these reports can be really scary, and it's important to know that these blood clots are extremely rare, and unfortunately, the risk of death from COVID is much higher. It should also be noted that symptoms of clotting have not been associated with the Pfizer or Moderna vaccines. We Got Us believes you should feel empowered in your decision to get vaccinated, and we recommend you talk to your health provider about your potential risk factors for developing blood clots before getting vaccinated, if that makes you feel safer about your decision. Additionally, if you have any symptoms of severe headache, leg pain, blurred vision, or abdominal pain within 14 days of getting your vaccine, you should contact a health professional as soon as possible. The Pfizer and Moderna vaccines require 2 doses, 21 or 28 days apart, respectively. The Johnson & Johnson vaccine is a single shot. Full immunity from COVID is reached typically 2 weeks after being vaccinated. All 3 vaccines do an excellent job at protecting people from developing COVID disease and being hospitalized. To reach herd immunity, we need 70% of the U.S. population to be vaccinated. And until we reach herd immunity, we still need to socially distance in public, wear masks, and take necessary steps to keep ourselves, our loved ones, and our communities safe. According to the CDC, vaccinated people can meet indoors without masks or physical distancing. This means once you and your loved ones are fully vaccinated and fully protected, you can get back to hugging your grandparents and enjoying small get-togethers with the homies. Importantly, no matter our vaccination status, we must continue to practice safe public health measures, including physically distancing and wearing masks in public spaces. For more information about the vaccines, COVID, and disparities data, visit the resources section on our website at wegotusproject.org. There, we have resources to learn more about the vaccine, and you can also request for our program to do a free empowerment session for your organization about COVID and the vaccines. Your state health department is another good website to check for information on how to get the vaccine. The latest administration just announced that starting May 1st, all adults will be eligible for the vaccine. We're on our way, y'all. Stay safe, stay masked up, and stay empowered.